one of the things that people do in social anxiety is they'll rehearse what they're going to say before they say it, which is such a complex cognitive manoeuvre, because you have to think what the person said, think what you're going to say, rehearse that, check it sounds all right compared to what they've said, and then say it. I mean, it makes it really, really hard. So this really complex that quite a lot of people have invented, because they wouldn't have heard about it, actually is really, really cognitively draining and makes them much harder to concentrate on the conversation. I'm Colette Hirsch, and I'm a professor of cognitive clinical psychology at King's College London, and I'm a clinical psychologist at the South London and Maudsley NHS Trust, working in the Centre for Anxiety Disorders and Trauma. Today we're going to be thinking about social anxiety and social anxiety disorder. So we all feel anxious from time to time, and often that's triggered or initiated by being in a social situation. So you might feel anxious when you're at a party and don't know people, or maybe when you're talking to someone in authority or giving a presentation. These would all be very typical situations when people might feel socially anxious. And what I mean by social anxiety is that kind of concern that you're going to come across in a way that would be embarrassing or humiliating. But that's very normal and something that all of us will experience. In terms of the social anxiety disorder, that is something where it's really interfering with your life. So you having to go to situations that cause you anxiety, perhaps, but really enduring them with massive distress, with lots of worry beforehand and chewing situations over afterwards, and a great deal of interference in your life because you don't really want to be in those situations, or you might avoid them altogether. In terms of the kind of physical symptoms of social anxiety, they would be like other types of anxiety, but the meaning of those symptoms can be quite different. For example, if I'm feeling anxious, I might have my heart racing and I might feel hot in the face, or I might find that my hand is trembling. With social anxiety, that would be concerning, potentially because I might be concerned that people would see me as anxious and judge me negatively for that. I also might be concerned that maybe I'm coming across as boring or stupid, which is also going to then make me really focus on myself and on the way I'm coming across. And I'll be thinking potentially that people are going to judge me negatively. So there are a range of different physical symptoms, and it really depends the ones that most concern an individual. But it would be lots of physical symptoms, also feeling sick or finding it difficult to concentrate. All of those things could, in some people's minds, make them perform poorly in a social situation, which they wouldn't want. People who suffer from social anxiety can often find that it's kept going from two types of things. One might be they avoid situations or do subtle behaviours in a situation that are really there to try and help ensure that what they're really fearing would happen won't happen. So those are called safety-seeking behaviours. So for example, if I'm really concerned about someone noticing me blushing, I might put my hands up onto my face, which would be a safety behaviour because then the person can't see my face, which would be red. However, inadvertently, probably in lots of situations, me doing this may draw more attention rather than less attention to how I'm coming across. So inadvertently, these safety-seeking behaviours can actually make people notice me more rather than less. Similarly, if I'm concerned about my hand trembling, I might hold my hand really stiffly, which actually leads to a bigger tremble. So there are certain behaviours that can be unhelpful, or even if they're not causing more symptoms, people think the only reason I survived was because I put my hands over my face, or I held my arm very strongly, and not realising that they would have been okay anyway. What's interesting about social situations is that people aren't very observant. They don't realise and don't notice symptoms of anxiety very much, and actually when they do notice a bit of anxiety, they rather like it. They actually find the person's more human and they can relate to them more, so it's not seen as a bad thing. But obviously when a person has social anxiety disorder, they're very fearful that they will be seen negatively, and so that's why they engage in these safety-seeking behaviours. The other area that we also know keeps social anxiety disorder going are the types of thinking habit that people have. So there's a tendency for people to, for example, draw negative conclusions from uncertain and unclear information. So if someone said, your talk was fine, the person might interpret that as that's really good, it's a really fine talk, positive. Or they might think, oh, that's meaning that they don't think it's very good at all, it's only fine. And so these differences in interpretation will then drive more anxiety if you make a negative interpretation. Similarly, when someone is, making a kind of looking at you while you're talking, if their face is unanimated, if you have social anxiety, you might think that they're judging me negatively, whereas if you don't have social anxiety, you might just think, oh, they're just listening. And so again, that more neutral or positive interpretation is really helpful in keeping us feeling calm in a situation. So these thinking habits can be really unhelpful. One other thinking habit that's really evident in social anxiety is a tendency to generate a mental image or picture of how you're coming across to other people. And that, we have shown from research, drives our own judgment of our own performance. Unfortunately, these images that people have when they have social anxiety disorder tend to be very exaggerated and very negative. So the person might think that they're really bright red or they're really, really trembling, when because internally it feels that way, externally it's not noticeable to the same degree. So these images have a really important role in keeping social anxiety disorder going, and actually can be based on a very early event in people's lives where they then think that they came across badly, but they then kind of roll out the same image. They don't realise, but they roll it out again and again and again in lots of situations, really fearing that they're coming across badly, and in basing their interpretation of how they're coming across on this image rather than on any objective ways that they are coming across. So in terms of knowing if you have social anxiety, I think that what we mean by social anxiety is different from shyness. So people may be a bit more of a shy personality, but that doesn't mean they have social anxiety. So certainly if it's interfering with your life and it's causing you to endure situations with distress or avoid situations altogether, and that's impinging on your life, then it would be worth trying to work out whether you have social anxiety disorder, because there are good treatments for it. Now, in terms of doing that, it would really be talking to a person who knows about psychological problems, so a doctor or a psychologist, and they would help diagnose whether you have that problem or not, and also help if you have more than one anxiety problem, which isn't uncommon. People also have depression, really helping you prioritise which of those issues is the one that should be tackled first, because it tends to be useful to approach the one that's going to make the most difference to your life first. In terms of kind of on sort of self-diagnosis, it's a bit more difficult, I think, but we as clinicians might use questionnaires, but you'd really need to have access to the coding manual, where you would actually be able to really work out what a score means and how to score things up. So if it isn't too interfering in your life, but you're noticing you're beginning to feel a bit socially anxious, you want to try and not let that continue and snowball. What we know is with anxiety, it can often be quite self-maintaining once the cycle of safety behaviours and thinking habits gets in place. So if you notice yourself avoiding situations more or enduring with a lot of distress, then maybe just try and let yourself really not avoid and go to situations, and don't try and do anything to prevent people noticing how you come across. You can do little experiments and see, actually, when I let myself be me, did anything bad happen? Do people think that I'm anxious and judge me negatively for it? Interestingly, most people actually quite like someone having a bit of anxiety. It makes them feel more connected to that other individual, and certainly they don't tend to notice when people are anxious. So that may well be useful. Making sure that you get some sleep, which again can be difficult if you've got a big social thing coming up that's making you feel very anxious. Eating well and exercise are all really good kind of self-care that will help manage that lower level of tendency towards social anxiety before it gets to be a real clinical problem. Now, if you have social anxiety disorder, so you have this really interfering with your life and causing a lot of distress, which up to a sort of almost one in 5 of us will have in our lifetime, so it's a very common problem, then there are 2 main ways of helping. One would be to take medication, and the other would be to have psychological therapy, in particular cognitive behaviour therapy. What that would involve is really working on the unhelpful safety behaviours. So there's safety-seeking behaviours where you're trying to hide the anxiety from other people, perhaps trying to change your response in those anxious situations and try to behave slightly differently, to be more you and just get lost in the situation, just kind of get more involved. And also, importantly, using exercise and techniques to try and change the thinking habits that occur when you're in social situations. So before I was mentioning that people often have a negative image of themselves coming across poorly in a social situation, and actually being able to change that image in some ways and realise that it's overly negative would be really useful, as well as maybe trying to understand and develop a more helpful, positive tendency to interpret things positively, more like people without social anxiety. So those kind of changing those thinking habits can also be really important and achieved via cognitive behaviour therapy. I suppose what I would like to say to you is that we all feel socially anxious at times, and it's something that other people can relate to and understand, and they won't judge you negatively for it. But you can get help. Do go and speak to your general practitioner or a clinical psychologist or someone who does cognitive behaviour therapy, and they will really be able to help you overcome social anxiety disorder, so that you can decide whether you go to that social situation rather than having anxiety decide it for you, because I feel that that's a really important right that you have.